Hello, everyone, and thank you for being here. Today, I want to share 5 things I really wish I had known before having surgery and staying in the hospital. These are not things that are always explained clearly, but they can make a real difference in your safety, comfort, and peace of mind. Everything I'm sharing comes from real life experience, and my hope is that this helps you feel more prepared and less overwhelmed if surgery is in your future. Today, I want to talk about 5 important things you should know before having surgery. These are things that are not always explained clearly, but they truly matter. I am sharing this from real life experience. I have had 9 surgeries total. 6 were on my legs, 2 were C-sections, and 1 was an outpatient procedure related to a cancer scare. Most of these were inpatient surgeries. I learned some of these lessons through experience, and I want to share them so you can be better prepared. Before surgery, nurses will give you instructions about what to do and what not to do. Some of those instructions are life or death, even if they do not sound that serious. There are also important things they do not always explain. One must know before surgery is to not eat or drink beforehand, and to take this rule very seriously. You will be told not to eat or drink for about 12 hours before your procedure. This includes all liquids such as soda, bottled water, juice, coffee, or anything else. Sometimes a very small sip of water is allowed for certain medications, but only if the medical team says it is safe. Even a few extra sips of water can be dangerous. When you are under anesthesia, your body cannot protect itself the way it normally does. You cannot cough if liquid goes into your airway, and this can cause choking while you are unconscious. I learned this firsthand. One time I took a couple extra sips of water, and when I woke up from surgery, I could barely breathe. I had to cough for nearly 30 minutes just to catch my breath. It was scary, and it was completely avoidable. The safest choice is to skip food and drinks completely. You can brush your teeth and use mouthwash, especially dry mouth formulas, but do not risk it. The rule exists for a reason. Another must-know before surgery is that your exact weight matters for anesthesia. Anesthesia is dosed based on body weight. Too much can be dangerous, and too little can leave you partially conscious during surgery. This can mean feeling pain without being able to move or speak, and this does happen. Make sure your weight is accurate. Do not guess and do not round. This is not the place for approximations. Another must-know before surgery is that every surgery carries risk, even elective ones. Anytime you are put under anesthesia, there is risk. This includes cosmetic or elective procedures. It is important to ask yourself honestly whether the surgery is truly necessary and whether the benefits really outweigh the risks. The medical industry is not exempt from error or financial motivation. What is routine for them is your body and your life. Do your own research. Watch real patient experiences. Learn the pros, cons, and long-term effects from people who have nothing to gain by telling you the truth. Another must-know before surgery is to expect dry mouth after surgery and plan for it. After you wake up, you will likely be thirsty and hungry, but you usually will not be allowed to eat or drink right away. Pack things that help with dry mouth, such as breath mints, gum, or breath spray. These small comforts make a big difference while you wait. Another must-know before surgery is to pack a comfort bag if you are staying in the hospital. If you are having an inpatient procedure, pack a bag and leave it with a trusted friend or family member who can bring it to your room once you are settled. Helpful items include a toothbrush and toothpaste, deodorant, wipes, lotion, lip balm, a hairbrush, light makeup if you want it, a pillow or blanket, your phone, earbuds, and chargers. Hospitals will not search your bag, and outlets are available. Having your own things helps you feel more comfortable and more like yourself. One last bonus tip is that once your doctor clears you to eat and drink, family and friends are usually allowed to bring you food and drinks. This can include bottled water, soda, and other drinks you like, along with snacks that do not need refrigeration and even fast food if you want it. Hospital drinks can be limited, and nurses are often very busy, so being prepared gives you more comfort and independence. You can always ask the nurses for ice. The hospital will also give you a cup to use, and it is yours to keep. If you have a favorite cup, you can bring it from home. If you like to keep one cup for ice water and a separate cup for soda or juice, it is helpful to bring an extra cup with you. When a nurse comes into your room, go ahead and ask for everything you need at once, because it may be a while before they can return. Surgery can be overwhelming, but being informed can make it safer and less stressful. If this video helped you, please like, share, or subscribe so this information can reach someone who needs it. If you have had surgery yourself, feel free to share what you learned. You might help someone else avoid a hard lesson. Thank you for watching, and I wish you peace, wisdom, and a smooth recovery if surgery is in your future. This video is for informational and educational purposes only. I am not a medical professional, and this is not medical advice.